Hey, what's up, everybody? So today we're talking about, does Ozempic help with weight loss, and specifically, is it a long-term effect? Is it something that's going to go away? And why Ozempic? Because Ozempic isn't something that's approved by the FDA for weight loss. So why are doctors using it off-label to treat weight? There's a lot of weight loss drugs. As you know, people are still fat. It seems like they don't really work. I mean, they might help, but people still take them. Like, people still take drugs like phentermine, which is a stimulant. Stimulants kind of help decrease your appetite level. Kind of increases your almost like your anxiety or the amount of adrenaline in your body. Ozempic works a little different. When they came out with these medications, they were strictly for diabetes. There's something called a GLP-1 agonist. So a GLP-1 agonist is just something that acts like the hormone GLP-1. And that's simply something that helps your body respond to the amount of sugar in the bloodstream by promoting the release of insulin from your pancreas. Now, releasing insulin from the pancreas actually would seem to have the opposite effect of actually increasing your weight, because insulin takes sugar and moves it into your other tissues, one of them being fat. So the main reason that GLP-1 agonists help people lose weight, and they all have this effect. So even the first one was Byetta, Victoza, Trulicity. All of these drugs have a weight lowering effect. The reason that people are using Ozempic is because there's another drug called Wegovy, which I'm not sure if I'm saying that right, but it's a silly thing to have to say Wegovy, but here I am saying it. So Wegovy is actually the same chemical as Ozempic, and the doses in Wegovy are a little different than Ozempic, but it's close enough where if a lot of people are finding that they try to get on drugs like Saxenda, which I made a video about, and Wegovy, which I haven't touched on yet, but these drugs are often not covered by insurance. Insurance companies have decided, I think, that they're not going to cover weight loss medications, even though weight loss does help other comorbidities. Like getting your weight under control probably would help decrease your chance of getting heart disease, diabetes. It's a huge problem. I'm not sure exactly the amount of money that is spent because people don't have their weight in control, but it's got to be astronomical, because it just causes all kind of things, and the bigger you get, the worse it is. So Ozempic has the potential to cause some weight loss. So does it work? So I think the best way to ask the question, does Ozempic work, is to look at Wegovy. And the reason is that Ozempic and Wegovy are the same drugs. So it's simply the drug company saying, we're going to have this drug for diabetes. Insurance companies are going to cover it because it's for diabetes. And we're going to create another drug called Wegovy and try to work with insurance companies to try to get them to approve it. But we know that they might not approve it, but we're going to market it as a weight loss drug. But people have kind of figured out that you can use Ozempic instead of Wegovy. And they're basically the same chemical. So I have made the transition to the computer. I want to share some information. So right now I have the Wegovy and the Ozempic package insert pulled up, and there's a lot of handy data in here. So this was a 68-week study with Wegovy, which, as I said before, uses semaglutide, which is the same drug in Ozempic. So simply an insurance issue. A lot of people are just taking Ozempic using similar doses, and the results can be expected to be similar. So in study one, we have 3 studies. So study 1 is obesity or overweight with comorbidity. Comorbidity just means some other issue. Type 2 diabetes with obesity or overweight. And obesity or overweight with comorbidity undergoing intensive lifestyle therapy. So that's kind of some help. So already we see there might be a diet aspect to this journey. So basically these individuals were about somewhere between 100 and 107 kilograms, or about 220 pounds to about 235. And they did percentage weight loss, so it's percent of body weight. Was it all fat? Was there some muscle in there, probably. There was a significant change in the placebo versus the Wegovy study. So again, just think Ozempic with the Wegovy. They're basically the same chemical. After 68 weeks in study 1, patients saw a 14.9% decrease. So for the patient's average weight, which was 105 kilograms, 105.4 times 2.2 that's 231 pounds. They saw after 68 weeks, which is, a year plus, they saw a 35-pound weight loss. It was a lot of weight. In study 2 is a 9.6% weight loss. So that's a 21-pound weight loss on average. And in study 3, where they had some help, some lifestyle help, it was 37 and about 38 pounds. So obviously, if you're like me, you're like I'm about 217. So let's see, if I lost 16% of my weight, what would that be? That would be 35 pounds. That'd be about 182 pounds. That'd be nice. So I think the first question is, does it cause weight loss? It can cause weight loss. We all like anecdotal stories. I had a patient who diabetes, really bad, kind of, sort of like, we can all relate, like that kind of, like that sugary food, the carb food, the kind of Panda Express, that kind of food. And she was on Victoza, which is another GLP-1 agonist. And she said it helped a lot in helping her reduce weight, and she lost a lot of weight. So I'm not saying to do it. I'm just saying I've talked to patients where they have seen weight loss. Diabetic patients on Trulicity, another similar drug, and Victoza, 2 really popular drugs for patients with diabetes, and they do see some weight loss with that. The caveat with these drugs is that they're increasing the dose to kind of like the highest dosage range to maximize that delayed gastric emptying. So delayed gastric emptying, just means that your stomach is just staying fuller longer and that food's not getting out. So one of the issues is when you start the medication, you have to start at a low dose or you can get really sick. And I have seen this in practice where doctors sometimes they make quick decisions. They're like, start with the 1 milligram dose. No, you actually have to start with the lower dose, which is I'll show you in the Ozempic package inserts, the 0.25 milligram once a week. Do that for 4 weeks, double that dose to 0.5 milligrams, and then it's optional if patients want to increase. Usually if it's something for weight, they probably will go to the 1 milligram after 4 weeks and then to 2 milligrams and probably stop there. So that's just something to consider. Like patients with diabetes, they might not go to that 2 milligram dose, but people trying to lose weight will be using the highest dose possible or highest dose recommended. So are there issues with that? The drug does have a black box warning, and if you guys watch this video and I see that there's some interest in it, I can talk a little bit about the cancer side effect, the scary cancer side effect. I just say that it's rare. I haven't ever really heard of anybody with this kind of cancer. It's a cancer related to the thyroid C-cell tumors, and it does seem that for some reason these kind of drugs, GLP-1 agonists, do cause tumor growth in those cancers. So it's not particularly common, but I mean that doesn't really help the people that get it. If there's a couple people that get it, So other concerns are increases in pancreatitis, hypoglycemia. So if you're already on a drug to lower your sugar, you add something else that lowers sugar, it can kind of cause more sugar, to be lowered. So hypoglycemia is an issue. Acute kidney injury, so that is just probably related to The nausea. So if the nausea, you feel like vomiting, you might be vomiting. That people will not be drinking enough water, and that can cause issues with the kidneys. Kidneys like to be wet. So if they're not wet, if they're dry, they can get injured. There's something with these type of drugs, and I don't know if it increases because of the higher dose. So like, there's something called immunogenicity. So that's literally, it's just your body attacking the drug and making it less effective. Some patients over time will develop antibodies. In the studies, the 1 year study for Wegovy, which is just basically Ozempic, it's very similar, same drug, just different pen kind of. They studied patients and they found there's like 3% of patients developed a Wegovy antibody or an Ozempic antibody. If you have that antibody, the drug's not going to be as effective. So I could see over time, like, I'm sure some people are going to be taking Ozempic that don't have diabetes for a long period of time. Are they going to start seeing immunogenicity, or where your body's developing antibodies against the drug, making it less effective? Certainly possible. So these are just some things to be an educated patient. If you want to go down this road, you should know about it. And I mentioned in the intro how to make the drug more effective. So if you look at the Wegovy study number 3, Wegovy study number 3 was the most effective, and that was because patients were undergoing intensive lifestyle therapy. So that might be a good time if you're starting this medication, to also consider like Weight Watchers, or maybe if you can get some support, like other people. Like I found, for me, I've lost weight. Like I'm a lot lower weight than my max. Like I think my max was like 255. I've lost a lot of weight since then. I gained some back. Like I went all the way down to like 190, and then I gained a lot of it back. But what's helped is if you have other people that are also dieting, and you can kind of motivate each other. Some things to consider is, think about, these drugs are basically treating hunger. So think about what makes you hungry and avoid those foods. So foods that tend to make most people hungry are sugar. There's really no reason to be drinking sugar. So like Coca-Cola, anything with sugar in it, sweet tea, that kind of. If you're like a fat, like me, you really do not need to be drinking sugary. You don't need sugar in your freaking beverage. So that's something to consider, is cutting that out. Gosh, if you can cut out artificial sweeteners, that's a good start. Snacking is probably kills just as many people as COVID. It's like, really, snacking is probably a habit that we have that is just making us really fat. And then probably eating less carbs, because carbs is kind of what turns to sugar. Sugar makes you hungry. So just thinking about foods that make you hungry. Maybe you're different. Maybe a steak makes you hungry. But for most people, the reason that people like explode in weight, you don't see this in people that don't eat sugar. So it's like, obviously sugar is why people are getting fat, and carbohydrates. So just trying to avoid those foods. If you're starting this, you might see that weight loss number go up. Now another question is, are patients keeping that weight off? And wouldn't it be great if they were? But unfortunately, it looks like once you stop the drug. So I looked in the Wall Street Journal. There's a nifty article. What happens when you stop taking Ozempic? So according to this article, and they cited the journal Diabetes, Obesity, and Metabolism, on average about 2/3 of patients have gained back about 2/3 of the weight after they stop taking Ozempic. So that's a concern. Obviously, it just seems intuitive to me, is like, if you want to keep the weight off, it's like, unless you're maintaining a different diet than you had previously, you are going to revert back and gain that weight. If you kind of change your thinking around eating and your habits, you don't snack anymore, you don't do sugar, you limit carbohydrates, you could keep the weight off, obviously. But if you're looking at at averages, and a lot of weight loss studies, they're not real promising. So, once you stop taking the drug, it makes sense that on average people are going to go back to their old ways and gain all that weight back. Even, in our own lives, it's like we do yo-yo. So I'm like, I was 255, I went down to 190, now I'm like 220. So it's definitely something that people will see. And the other question, of course, is it worth it? It's a very expensive drug. It's something like $1,300 a month. So, again, that's why insurance companies are kind of balking at paying for Wegovy. You might even see in the future where insurance companies are saying, we're not going to cover Ozempic unless you have a diabetes diagnosis code in the prescription. Like, you could see insurance companies going down that route because historically they do not pay for weight loss drugs. Is that right? I mean, obviously losing weight helps patients' health. I mean, it's obviously, it helps your joints, it helps your mental health, it can prevent diabetes if you have your weight under control. So there's like tons of stuff where having a lower weight is helpful for patients, but historically insurance companies really don't pay for weight loss medications. It's kind of in the category of like erectile dysfunction drugs. It's like sex is like an important part of life, but they're just like, they don't cover it, or they only cover 3 tablets or whatever. So that's just something to think about, is in the future will that happen? Right now it looks like Ozempic is being covered by the insurance companies because it's also being used for diabetes. And so that's why people are using Ozempic versus Wegovy, which is actually marketed for weight loss, but people are using Ozempic off-label because insurances are covering it. So is it worth it from the standpoint of you have to inject yourself every week? It's probably not that big a deal. I don't know what the long-term side effects are going to be. 10 years down the road, people are continuing to inject themselves to keep that weight off. Is some other issues going to happen? Like I said, personally, I probably won't go down that road, but if you do go down that road, leave a comment and talk about it. I'd love to see some people kind of seeing what happens. Have you lost weight? Have you changed your diet? So I hope you all found this interesting. If you did, please give me a thumbs up and please subscribe. Thanks a lot.